back to you, our viewers still with us on the Saudi Morning Show, and now it's time for the first discussion of the day. But before the discussion, we have some info regarding the discussion, which is about the dental treatment for pregnant women, where it says pregnant women who have a current concession card do not have to go on a waiting list to see public dentist. You will be given the next available appointment. Visiting a dentist while pregnant is highly recommended for your own well-being and that of your unborn child. Routine dental treatment is safe during a pregnancy, although some procedures or medications should be avoided in the first 3 months. So be sure to tell your dentist you are pregnant. And to know more about this topic, it's time to be welcoming Dr. Mظفرأبوزيد, who is a dentist, joining us in the studio this morning. Assalamu alaikum. Good morning, doctor.
Good morning.
It's a pleasure having you with us in the Saudi Morning Show. As I just mentioned, our topic is about pregnant women and dental treatment. Why it is so important to have such topic nowadays? Before getting to the questions, why it is very important to have a topic about the relation between pregnancy and dental care?
Okay, the first, I wanted to talk about some people. They think that the pregnancy is a disease or is sick, but she is a normal human. That she has some. We have to take some precautions in the treatment, and she have to take care of her health and oral health in general health and oral health especially. So the perturbation of hormonal secretion for the pregnant, give her some bad moods. Sometimes she can't take care of her oral hygiene. She didn't make brushing. Sometimes this is that increase the possibility of caries of the accumulation of black bacteria that's give the problem of caries or another problem. So the pregnant, she has to check up for her teeth in the first days, because if we have any small problem, we can treat it before it's become a big problem.
And doctor, it's something that pregnancy. Many of the people during pregnancy, they don't know really many of the steps. As a dentist, you see many of the pregnant people, the pregnant women, or even the couple. They kind of neglect their oral hygiene, or they don't visit regularly to the dentist. How common is this that they'll go ahead and ignore their regular visit or more common visits, especially during pregnancy?
Oh, yes, this is the problem. That's there. All the people, they have another impression about the pregnancy, that no, I am afraid for the dentist because sometimes I wanted to take care of my baby. No, I can't go to the dentist. No, it's normal. As I told you, this is normal human, but the problem that we will take care of some precaution, medicine or some precaution for before she will take any treatment. She will make any treatment in the dentist. The first problem for the woman, pregnant woman, that there is sometimes the problem of bleeding, the gum disease. It will be developed in gingivitis or periodontitis. This is the main problem for the pregnant. So it's important to take care to make checkup in the first days of pregnancy to take care and make prevention of the other problems.
So we're talking about bleeding here, which is the first important issue for pregnant women. What are some of the other issues that are related between dental care and pregnancy, other than bleeding?
Okay, the bleeding will increase if you didn't treat the bleeding. Bleeding, it's caused by the accumulation of tartar. The tartar will accumulate it after if the patient, she didn't take care of the oral hygiene, she didn't brush her teeth. So it's become the bacterial plaque become tartar. That will give the bleeding. So the treatment is scaling remove this starter, remove the cause, the main cause of bleeding, then the patient she can complete without any another problem.
So any delay could cause some complications.
Yes. So she, if she treat the main cause, it will not develop the other problem.
And doctor, you know, dental treatment for pregnant women is something that, like you mentioned, it's not it's entirely about the procedures, but the medication, and about how much, because they're worried about the health of the mother, and they're also worried about the health of the unborn baby. It seems like, you know, the stigma sticks to it, because they say they don't want to go ahead and do something they'll put them at harm's way. This is a quite opposite. You should definitely seek some type of treatment, whether you have any complications, any gingivitis, because if you go ahead and ignore it, it'll be more escalated and become more complicated. What are some of the common ones that the pregnant women are allowed to go ahead and have dental treatments, and what are some of the ones that you need extra examinations before?
Okay, all the treatment can be made for the pregnant woman, but the safest time is the second trimester of pregnancy. So she has to check up. We will make all the treatment for the pregnancy. But we will take care that there is no X-ray, because it's make some mutation radiation for the baby, and we will take also that the time of treatment, it's not too long, because you know that especially in the first 3 months. 3 months, yes, for the first trimester for the pregnancy.
Is it because of sedation?
Yes, because sometimes it's you can take care, because it's not fixed, not yet fixed, the baby. So you have to take care. Also, there is some antibiotic. It's not allowed to give it to the pregnancy, like a tetracycline, because it will give the bad some problems for the baby, especially in dental for the baby. Then the teeth of the baby will become another some problems for the teeth of baby. So it's not allowed to give the antibiotic, a tetracycline. The other treatment, for example, the root canal treatment, we can make it, but we need always the X-ray, so we will make the first visit to take care, because sometimes there is emergency cases for the woman, pregnant woman, so we will take care of we will make the first visit to make calm the patient, and she will not, she hasn't any pain. After she will deliver, we will complete the other steps.
So something is very important, especially for pregnant women, because I feel, you know, their hygiene or their treatment is very important, because I feel, you know, for the woman to have any type of pain, like I'm sure you experience many patients, when they come there for toothache and pain, it's not something you can just go ahead and dismiss it, because they will not feel comfortable, they will not be able to have a normal pregnancy, and many complications arise. And doctor, one more question, what are some of your advice? Do you advise for a pregnant woman to go ahead and try to prevent, as a prevention, to go ahead and avoid any complications, whether it's they have to do root canal or anything? What are your advice about it, like as a dentist?
Yes, the first step is the prevention. The prevention, if she will take care of her teeth before pregnancy, this is the first step. Second step, we will treat the small problems before it will develop to be a big problem or some swelling, another things. We will try to take some precaution for the pregnant woman about oral hygiene. How she will take care of her teeth, for all the oral hygiene, because you know that there is some problems for the pregnant woman, that she is not in good mood for all the problems. This is the first trimester that's we always afraid of the problem.
Indeed.
After that, she will take care, because this is another a new situation for the hair.
And Dr. Mudaffar, do you think that most of the women are fully aware of the importance of taking care of their dental health during a pregnancy?
I think no, because there is some, as I told you, some people, they are always afraid of, no, I don't want it to take, I will I don't want to lose my baby. I wanted to take care. It's okay, my teeth. But before there is a proverb that's one baby, one teeth. That's meaning if you have one baby, you will lose one tooth. So, but this is it's not true.
So after 5 babies, no.
Sometimes they
And the doctor, after giving the birth, after delivering, is it okay to be going for a dentist, or they should delay maybe the visit and the checkups?
well, it's okay because it's written like
Back to normal.
Yes, it's
Right
normal.
away.
It's back normal. It's normal.
And as you mentioned in your advices that women should take care, as you are working in a clinic, usually the first baby is the most important issue. Then they would know the way.
Yes, sometimes, yeah.
This is the
Because they are, this is the first. They don't know how to
deal with
do
this.
Sometimes it's they are shocked for the first. They are take care most than the other babies.
So something about, it's just their subconscious kind of worries more than they required.
Yes, this is not only for the dentist. All the life. They are the first. The first baby is the most important.
Yes. And doctor, how often do you think a pregnant woman should go ahead during her pregnancy visit a dentist? Because I feel like it's something that the more precautions, like a physician said, as a pregnant lady, she needs to go to have more regular checkups than usual. How many more often should she go to a dentist?
I think once or twice by all or her pregnancy time.
Once or twice to make it okay, indeed. And we will be taking a short report, and we definitely continue this very important discussion about dental treatment for pregnant women, so you don't want to miss it. Stay tuned.
I am Dr. Zev Kaufman. As parents, the greatest responsibility to our children begins even before conception. So when should a future mother see the dentist? If you're planning to have a baby, visit your dentist or hygienist for an examination and cleaning before you get pregnant. Poor oral health in expecting mothers, specifically periodontal, gum disease, can lead to low birth weight of the baby and even possibly premature birth. Pregnancy is stressful enough without the addition of toothaches and dental problems. The stress you experience and medications you have to take are passed on to your baby. Once you are pregnant, keep practicing excellent oral hygiene. The second trimester is the safest and most recommended time for a routine dental visit and a good cleaning. Even the smallest amount of plaque can cause a pregnant woman's gums to bleed and swell. What normally just would be a gingivitis can become a severe, painful gum infection. Once the baby comes and you are able to hopefully get some help, come in, relax in the dental chair for a routine dental cleaning visit. Remember, your baby depends upon you, but if you are hurting and are not at your best, you will be doing your baby and family a disservice. It is best to avoid dental problems. But if you are pregnant and have dental problems, such as broken down teeth or gum disease, go to your dentist right away. So now you know. From Prosthodontics and Implant Surgery of Manhattan, where people come in with missing teeth and leave with winning smiles, I am Dr. Zev Kaufman.
Back to you, our dear viewers. You're still with us in the Saudi Morning Show, and we are still in discussion with Dr. Mظفرأبوزيد, who's a dentist. And Dr. Muzaffar, I want to ask you about the risky months and the most dangerous time during a pregnancy. It's a long period of time, 9 months. So what are the most important months during the pregnancy?
As I told you, that the safety time is the second trimester for her, but the risky is the first 3 months and the first trimester and the last month. So because the first trimester, because she has a lot of vomiting, she will not accept anything maybe in her mouth. So you will take care of the treatment that we will try to make it in the second trimester.
Indeed. And doctor, during the break you mentioned something about medication, because I got really interested about, there's some medications that the pregnant women are allowed to take, but there's some that they are not. you mentioned something about anti-inflammatory medicine, and then that's not allowed, and you're allowed to have like paracetamol. Can you elaborate more about it?
Yes. You know that the pregnant woman, she will has headache, so it's not allowed to give her anti-inflammatory, or that they know it in the people they know ibuprofen. We will give only paracetamol. That's give her this is the medication for the headache for the pregnant woman. And that we said about the antibiotic, we will take care. The safety antibiotic is the amoxicillin.
Indeed. So it's something that's very important, especially for the pregnant women or the in general couple. Anyone that that really has to go ahead and go through pregnancy. There's too much information, because you got to make sure you're on the safe side, then better than understanding and realizing the mistake you made later.
Yeah.
So I think it's very important to especially be very clear with your physician, with your dentist, any caregiver, because I feel like as a dentist, when you have a pregnant woman comes, you want to know the entire history of it. You want to ensure any complications, any allergies, because there's the small worry of that. You'd rather be safe than sorry. So doctor, any last words or advice you'd like to tell our dear viewers about the topic we're discussing today?
I want to thank you for this visiting. Thank you.
Indeed. So something that's very important, like doctor, because the dental treatment for pregnant women is something that many people do not really touch on the topic. It feels like it's one of those subjects, even for me, Naghazi, we don't really hear this as much, because I feel like, pregnant women sometimes, they go ahead and neglect, their dental hygiene. They do not understand the full precaution or the full dangers of it, especially when we have Dr. For joining us today about telling us about as a dentist, seeing the kind of dangers that may go ahead and definitely go ahead and be present, especially for the pregnant woman.
True, yeah. We're talking about some of the basic steps that should be taken during a pregnancy and even before that. And this is why it is very important for everyone to be familiar with what to do during a pregnancy, especially for females who are pregnant for the first time.
Indeed.
I know what's going on. Thank you, Dr. Muzaffar, for being with us today. And inshallah, we hope to see you again with different topics.
Inshallah.
Thank you. And thank you, our dear viewers, for watching this segment. Now it's time to move to the top 10. We'll see it, and we'll be back with other discussions. Stay tuned.